Welcome to Nursing School Explained, in this video on pharmacokinetics, or in other words, how a medication travels through the body or what the body does with different medications. And there are 4 steps of pharmacokinetics. And kinetics, just think about movement, so kinetic energy, and pharmacokinetics meaning drugs moving through the body. So the 4 steps are: number 1, absorption, which this video will focus on. After we absorb the medicine, it gets distributed, metabolized, and excreted, but I have separate videos about these other steps. So first of all, for absorption, it depends on the route of administration and how long it takes from administering the medication for it to reach the bloodstream. And the effects depends on the rate, the amount, and the route of administration. When we talk about the route of administration for medications, we always have to distinguish whether it goes through the GI tract or it does not go through the GI tract. So medications that are absorbed through the GI tract are referred to as enteral medications. Think about enteric bacteria back from your microbiology classes. And then parenteral, which is all other methods of administration besides the GI tract. So for enteral medications, one of the most common ones used is PO, so by mouth, and that depends on several factors. The way that the medication is absorbed depends on different factors. So first of all, the ability of the GI tract to absorb, so any underlying disorders. The pH of the stomach, remember that it's an acidic environment, and so some medications might be absorbed better in an acidic versus an alkaline environment. The food that's present, that's why some medications are taken with food and some are better taken without food. Other medications, because some might interact with each other in the stomach and they might not be able to permit the second medication to be absorbed as much as we would like it to be available in the body. And then also, if it's a liquid versus a solid medication, so think about any kind of liquid, Tylenol for example, versus a pill. A liquid medication is going to be absorbed faster than a pill or a capsule because it doesn't have to be broken down, it's readily available. The other enteral medication administration is sublingual or buccal, so anything that pertains to the oral mucosa. And that absorbs pretty quickly because there's a lot of vascularity in our oral cavity, and so medications are absorbed pretty quickly. Buccal medications, I was trying to think of an example. Unfortunately, I couldn't come up with one, but sublingual, anything from like Zofran or nitroglycerin are used pretty frequently. And then there's also the GI system, so it can be administered PR, per rectum, and then per vagina. It's not necessarily the GI system, but it's also another route besides the other ones. And those administration routes are reserved for patients who cannot or should not swallow. So think about somebody who's actively seizing, we might not be able to establish an IV, but we want to get some anti-seizure medication on board, or a benzodiazepine to halt the seizure, so a rectal suppository might be indicated. And then the other reason patients that shouldn't swallow are maybe somebody who has had a stroke or some sort of head injury that has impaired swallowing, so we wouldn't want to give them anything by mouth because that could, lead to complications of aspiration and so forth. And then the other route, so parenteral, everything but the GI system. We can give medications by the route of inhalation. It depends, however, on the patient's inspiratory effort. How deep of a breath are they able to take, and how much of the drug are they able to take in through their lungs, but it's quickly absorbed through the alveoli. So that's a very nice alternative route for some emergency medications specifically. And then intradermal or topical medications, so anything that pertains to the skin is going to be absorbed a little bit slower. Primarily topical and intradermal medications have local effects, but they might also be absorbed into the systemic circulation and have some minor or to a lesser degree systemic effects. Then subcutaneous or intramuscular depends on the medication solubility in water, because our bodies consist to the majority of water. And so the drug's ability to dissolve in water will depend on how much of it gets absorbed and how quickly. So highly soluble medications take about 10 to 30 minutes to absorb, where poorly soluble medications take minutes, sometimes even hours to be absorbed. And then the last but not least, IV, intravenous route of administration, has immediate effects. There are no barriers to absorption at all. It hits the bloodstream as soon as we push that medication, and it is available right away to take the whatever desired effect. So thank you for watching this video on pharmacokinetics and the absorption of medications. I'll put the link in the description of the video below that refers to the other 3 steps of pharmacokinetics, so you can put all the puzzle pieces together. Thanks for watching Nursing School Explained. See you soon.